Chapter 1: The Uninformed Patient. Have you ever wondered why your psychiatrist doesn't tell you everything about the medication they prescribe? It's a question that's been gnawing at the edges of our collective consciousness for a while now. A question that demands an answer. Picture this: a woman named Sarah is struggling with severe depression. She visits a psychiatrist who prescribes her a popular antidepressant. She's desperate for relief and trusts her doctor's judgment. Sarah starts taking the medication, oblivious to the storm that's brewing beneath the surface of her daily pill. Chapter 2: The Unforeseen Side Effects. In the first few weeks, Sarah feels better. But soon, she starts experiencing severe side effects. She's constantly nauseous, her appetite is gone, and she's more anxious than ever. She wonders why her psychiatrist didn't warn her about these side effects. Wasn't it her right to know? And then there's John, a middle-aged man grappling with bipolar disorder. His psychiatrist prescribes him a mood stabilizer. John is hopeful, but soon, he begins to experience tremors, a common side effect of this medication. He's startled, as his psychiatrist didn't mention this. These are not isolated cases. They're the tip of an iceberg, a chilling testament to a systemic issue. Psychotropic medications, while often necessary, come with a long list of potential side effects that can significantly impact a person's quality of life. Chapter 3: The Lack of Disclosure. Yet, many psychiatrists fail to fully disclose these side effects, leaving patients uninformed and unprepared. It's not about creating a climate of fear, but rather one of informed consent. It's about arming patients with knowledge so they can make the best decisions for their health. It's about respecting their right to know what they're putting into their bodies. Chapter 4: The Root of the Problem. So, why does this happen? Some suggest it's because psychiatrists fear that patients will refuse treatment if they know all the potential side effects. Others argue that it's a product of a system that prioritizes quick fixes over patient education. Whatever the reason, it's a dangerous practice that needs to change. Because the reality is, these substances can be harmful to our bodies and brains. They can cause physical and mental side effects that range from mild to severe. And patients have a right to know this. Chapter 5: Empowerment Through Knowledge. So, what can you do? Educate yourself. Ask questions. Don't just accept a prescription without understanding what it could mean for your health. Demand transparency from your psychiatrist. Remember, it's your body, your brain, and your right to know. Because in the end, it's not just about medication. It's about respect, autonomy, and the right to make informed decisions about your health. So, don't be afraid to ask the tough questions. Knowledge is power, and it's time to seize that power.